What began as a vision in one man's heart has grown into a living, breathing institution, one that delivers evidence-based insights, applies rigorous economic analysis, and shapes policy that translates into real, measurable change in people's lives. May Dr. Kenneth Ojo's courage continue to light our path. May his belief in people-powered system inspire our every step.
Let me begin by appreciating Mrs. Veronica Ojo for keeping the flag flying, keeping the legacy of your husband, and what he's been able to put together to live for us that we are celebrating today. I will pray for the family to continue to remain happy, strong, and God will continue to be with you.
Specifically, I want to say that since the assumption of Dr. Kelechi Ohiri as DG of NHIA, he has articulated a clear direction for the National Health Insurance Authority to catapult Nigeria towards universal health coverage. And CHECOD has supported us across all these dimensions. I know they have supported us in strategic and operational planning. They have supported us in the areas of data management, and they are currently supporting us in the areas of health technology assessment, among others.
I have been honored not only to be here, but to have been a participant in the design of the program in Nigeria.
So we had the opportunity to do a rapid diagnostic that began to outline what our priorities should be around improving effective governance, and by governance, that stewardship that responds to the yearnings of Nigerians, and better coordinating in a manner that incorporates an incentives framework and ensures that as a country we are rowing in the same direction and using the BACPF as an entry point.
And which also is very important is the fact that our colleagues at CHECOD that took over, that continued the work that Dr. Ojo started, have done a very tremendous job.
Before the name of SWAP started, what the minister used to say is we're embarking on an all-of-government and whole-of-society approach. And so that's literally bringing everybody together.
At the level of the Director of Public Health, we are trying to integrate the three diseases.
The principle of SWAP is something that we've discussed. It took time for a lot of people to exactly understand what SWAP is.
The issue of momentum beyond political transitions, I think, is the key matter that we really need to focus upon.
What the sector-wide approach is trying to address is to fill in those vacuums so that government is taking back ownership of governing the health sector.
I'm glad to say that the M&E TWG for SWAP is the strongest TWG or governance body that we have. We beat our chest to that.
But going into the future now, we have an additional dimension that we have to really think about.
Dr. Mutaka, we really appreciate you for your support and your confidence.
We should not ignore all the other social determinants of health, which is, of course, your water, environment, all the other things that have to do with what gives you good health, apart from having to go to health facilities.
Now, what we're able to do is take the performance that the program should be giving, break that down into individual targets for every day, for every community healthcare worker, and so they have a daily plan to achieve. So that's forward planning. And if they don't achieve it, they have to put a reason in, and if they achieve it, then great.
We all have to commit. When we say we are coming to the drawing board together, when you talk about the principles of SWAP, when you begin something, you've got to finish it.